If you've been sitting on the toilet, straining, feeling like there's a rock stuck right at the end that just won't move, I want you to know two things right now. First, you are not broken and you are not alone. This happens to millions of people, especially after 60. Second, there is a real reason your body gets stuck like this, and there is a real research-backed way to get things moving again, often within a day. Quick note before we go further. This channel is for general education, not medical advice. And I'm not your doctor. Nothing here is a diagnosis or a prescription. If you haven't had a bowel movement in several days, are in severe pain, or see blood, that's not a wait it out situation. That needs a doctor or urgent care today. What we're covering here is the common, frustrating, everyday version of stuck hard stool E and the one simple addition that the research keeps pointing to. Consider someone like Margaret, call her that, a composite of a very common story. 68 years old, active, eats pretty well by her own account, but for the last few months she's been going 3, sometimes 4 days between bowel movements. When it finally happens, it's hard, small, and painful, and she leaves the bathroom feeling like she didn't finish. That is not normal aging. That is a fixable mechanical problem, and by the end of this video, you'll understand exactly what's happening inside your colon and the 1 teaspoon that changes it. Here's what almost no one explains to you in a rushed appointment. Constipation isn't one problem. It's usually one of 2 different plumbing problems, and the fix is different for each. Problem 1, slow transit. Your colon's job is to squeeze stool along, like a wave moving down a pipe. When that wave slows down, stool sits in the colon too long, and your colon keeps pulling water out of it. The longer it sits, the harder and drier it gets. Think of it like a sponge left in the sun too long. What was soft becomes stiff. Problem 2, outlet dysfunction. The stool reaches the very end, the rectum, and gets stuck right there because the muscles aren't coordinating the release properly, or the stool has already hardened into a mass. This is the I can feel it right there, but it won't come out feeling. For most people dealing with everyday hard, stuck stool site, not a full medical impaction, the fix that actually addresses the mechanism is water. Specifically, getting more water into the stool itself, not just into your body. And this is where the research gets interesting, because there's one simple food that does this better than almost anything else people reach for. Symptom/scenario. You've tried more fiber, maybe a fiber supplement, and it either did nothing or made the bloating worse. Mechanism. Not all fiber behaves the same way. Insoluble fiber. Think wheat bran. Adds bulk but doesn't necessarily pull in water. Soluble, gel-forming fiber does something different. It absorbs water and turns into a soft gel that the stool moves through easily. Analogy. Picture the difference between throwing dry sand into a pipe versus a soft, waterlogged sponge. One scrapes and clogs, the other glides. Illustrative case. Someone like Margaret trying a generic fiber gummy for 2 weeks with no real change because it wasn't the gel-forming kind and she wasn't drinking enough water alongside it. Nuisance versus emergency line. Bloating and gas from adding fiber too fast is a nuisance and usually settles in days. No bowel movement at all for more than 3 days or severe pain is not something to keep pushing through at home. Safe action. Increase gel-forming soluble fiber gradually with water and give it 3-7 days before judging it. Loop 2, the 1 teaspoon remedy, ground flaxseed, symptom/scenario. You want something simple, cheap, and backed by real comparison data, not a random home remedy. Mechanism. Ground flaxseed is rich in soluble fiber and mucilage, a natural gel-forming substance. When it hits water in your gut, it swells into a soft gel that coats and softens the stool, making it easier for your colon to move it along, while also adding gentle bulk that stimulates the colon's natural squeezing motion. Analogy. It works like adding oil and a soft cushion to that pipe at the same time, softening what's stuck and helping it slide. Evidence drop. Consuming about 50 grams of flaxseed flour per day has been found to be comparable to lactulose, a standard pharmacy laxative for improving how often bowel movements happen. That's a real direct comparison to a medication people are already prescribed for this exact problem. The prescription, education, not medical dosing, start small, about 1 teaspoon of ground flaxseed. Whole seeds pass through undigested, so ground is what matters, stirred into water, yogurt, or oatmeal, ideally in the morning. Increase gradually toward 1 to 2 tablespoons over a week or two, always with a full glass of water, since fiber without enough water can make things worse, not better. Bridge. Flaxseed handles the softening side of the problem, but there's a second piece almost nobody talks about: timing. Loop 3, prunes and the sorbitol effect. Symptom/scenario. Grandma always said eat prunes, and it turns out Grandma had a mechanism on her side. Mechanism. Prunes work not only because of fiber, but because they contain sorbitol, a sugar that pulls water into the intestine, along with polyphenols that support healthy stool consistency. Analogy: sorbitol acts like a small magnet for water sitting in your gut, drawing extra moisture right into the stool as it passes. Illustrative case: someone like Margaret pairing her morning teaspoon of flaxseed with 3-4 prunes at night, reporting a noticeably softer, easier bowel movement by the next morning. Safe action. This is food, not medication, but if you have diabetes or are watching sugar intake, count prunes as part of your daily fruit portion and check with your doctor about how they fit your plan. Loop 4. When it's already stuck. The medically recognized escalation path, symptom/scenario. You've already tried fiber and water for a few days, and you're still completely stuck, uncomfortable, or it's been several days with nothing. Mechanism. At this point, home fiber remedies are often too slow because the problem isn't lack of fiber anymore. It's an already hardened mass sitting in the rectum that needs direct water content, not just future prevention. Evidence drop. Fecal impaction is what happens when stool hardens in the rectum and actually prevents passage. And when that happens, doctors typically recommend oral laxatives such as polyethylene glycol, which pulls extra water into the colon over 2 to 4 days to soften and move the mass. Polyethylene glycol is well studied enough that it's recommended by the American College of Gastroenterology as a first-line option for chronic constipation. This is not some obscure remedy, it's genuinely the most evidence-backed option available without a prescription. The nuisance versus emergency line stated plainly: straining and discomfort for a day or two is a nuisance. No bowel movement for several days combined with severe pain, vomiting, or a swollen hard abdomen is not something to treat at home. True fecal impaction sometimes requires a doctor or nurse to remove the hard stool directly, followed by an enema, and that is not something to be embarrassed about. It's a routine medical procedure. Safe action. If home measures haven't worked within 2-3 days or you're in real pain, that's the line. Call your doctor or go get seen. Never insert anything or attempt to remove impacted stool yourself. Let's be very clear on the 2 lines that matter most tonight. 1. Mild, everyday hard, or infrequent stool. Safe to work on at home with fiber, water, and movement, and it's reasonable to give it several days to a week. 2. No bowel movement for multiple days with pain, a swollen belly, vomiting, or blood. That is not a home project. That is a phone call to your doctor today, and a caution specifically on the remedy. Don't jump straight to a large amount of flaxseed or fiber if you're already impacted and in pain. Stimulant laxatives and aggressive fiber loading without enough fluid can actually worsen impaction in some cases, especially in older adults, which is exactly why this video is for prevention and mild, everyday stuck stool, not a substitute for medical evacuation of a true impaction. So here's what your body is actually telling you when stool gets stuck. It's not that you're doing something wrong. It's that the stool has lost water, either because it moved too slowly or wasn't given enough soluble fiber and fluid to stay soft in the first place. Tonight's plan is simple. 1 teaspoon of ground flaxseed in the morning with a full glass of water, a small handful of prunes if you tolerate them, and slowly increasing your total water intake through the day. Not all at once. Give it 3 to 5 days before you judge whether it's working. And remember the line we drew tonight. Mild and stuck is a home project. Several days, severe pain, or a rigid belly is a doctor's appointment, not a wait and see. If this helped, type the word relief in the comments. It genuinely helps this reach more people quietly dealing with the same thing. And if you want to understand why this problem gets more common specifically after 60, the actual muscle and nerve changes behind it. That's exactly what the next video breaks down. Watch that one next.